Well, welcome here to the day two at Health 2025, where we're in the Boombostic Health podcast booth. We wanted to do a quick recap of what's going on, both with the diagnostic zone as well as at the bigger stage conference here, where it's truly this incredible ecosystem that's brought together. I don't know, it's somewhere around, I've heard anywhere from like 12 to 15,000 attendees.
Yeah, it's true.
Is that what you've heard?
Yeah, about 13,000, which is 20% more than last year.
Oh, wow.
Yeah.
Okay, great.
It's growing.
Yeah, well, this is my first year here, actually, and I know you've been coming since the
Yeah, this is
beginning.
my sixth year.
6 year.
Yeah.
And this, for the first time ever, is the diagnostic zone, which we're the exclusive diagnostic zone podcast here. And in the podcast booth, we've had 8 guests today. We've had 8 guests, and it is just unbelievable the kinds of insights that they've shared. I wanted to share a couple of highlights. There are some major themes that are really coming out. One is everybody has something to say about AI. Two is there's definitely an emphasis on preventative care.
Yep.
And cancer being one of those major areas. I had one guest today, Michelle Zimmerman, the co-founder and CEO of Previvor Edge, for example. That's a newly funded company just launched, and they're focused on helping to understand the risk of every individual's cancer, everybody's cancer risk, and on every single dimension. So it's like, imagine that being a counterpart to your primary care journey. Makes a lot of sense instead of waiting to find out, oh my gosh, I have this terrible diagnosis. So that was pretty cool. Also, on more of the big company side, I had Lathe Bigler, general manager from First Data Bank, Vela, which is effectively a competitor to SureScripts. He didn't really want to call it that, but it was. And I think ultimately more of, I would call it like a white hat version, where they're not owned by, it's not the fox guarding the henhouse. The CVS or somebody doesn't own them. So they're really there to bring transparency.
Right.
And then one more I'll highlight. I had the CEO of Health Gorilla here,
Yeah.
which we've all kind of known the Gorilla for years. It was originally started by this guy, Steve Gaskin, I think all of us know. And now they've gotten a new CEO in place. Steve moved on, and Bob Watson, he was talking about how Tefka is really creating this tailwind to interoperability.
Yeah.
But perhaps you could talk, Elliot, a bit about this bigger picture of what you're seeing at the conference this year.
Yeah. So the idea was that diagnostics is playing such a huge role across the entire ecosystem of healthcare, and therefore the leadership at Health, which are really kind of setting the tone for innovation in the industry, said that it makes sense to create a diagnostic zone, to focus everybody in one area, to have a stage for thought leadership, and to really showcase what's happening in diagnostics and how it plays a role across the entire floor here. All companies are involved some way, one way or another, with diagnostics. Obviously, AI plays a huge role. There's a nice AI zone as well. And it's nice to see you mentioned that there's this connecting kind of tissue between all these organizations that are really, really solving preventative care. And I think that the reason that it is so important that preventative is coming to the forefront and solutions are being enabled is, if we don't tackle preventative, we're going to have more and more people arriving to the age of Medicare, and the system will not be able to support everyone. So this is kind of preventing the collapse of the healthcare system by doing more diagnostics, more preventative care, showing people early on what they have, symptoms, if it's cancer or anything else. And we're seeing that here with the various diagnostic companies. There are companies, for example, that can take a very easy micro container of blood at home. Never had that before. Or companies that now are good friends from Gene by Gene. They're doing whole genome sequencing at prices that we cannot imagine. This $100 genome. A few years ago, not long ago, it would be $5,000.
Right.
So this is what we're seeing. Preventative in the forefront. Diagnostics plays a huge role. Everybody's in this together. We really have to solve it, and it's being solved and implemented and pushed through the system so more and more patients can actually use it. Home testing innovation is huge. So all these things are connecting very nicely, and we're seeing it here on the floor.
Yeah, there is a lot of innovation coming through that kind of changes the landscape. Emily, what are some of the observations that you've had since you've been at your first Health this year?
Yeah, so I spent a lot of time actually at the stage over there listening to some of the products that are recently launched. And to your point, there is a lot of focus on biometric and personalized medicine and folks actually just taking advantage of or taking ownership of their own health data.
Yeah.
And some of the products that have been launched are incredible. Like there was one wearable that was the tiniest, smallest little wearable that will and it's non-invasive, whereas like a glucose monitor is invasive, and it has the ability to light up and show you when something spikes in your body. And they're talking about using that type of technology going forward in like the next pandemic to show when you've been exposed to certain things. So it is just absolutely incredible, the technology that's coming out.
Yeah, and what I think is interesting in connecting to what you're doing, we've been talking about a lot about regulatory environment and what that means. And these kinds of devices, how do they go and get approval from FDA? What do the patients think if it's FDA approved or not? So you can talk about the whole idea of how do you work with regulatory agencies the right way?
Right.
There probably is some kind of an acceleration of approvals and innovation happening now with the current administration, which is pretty awesome. So
yeah, no, absolutely. I think there's a fear of working with regulators, but if you can actually partner with them to expedite the approval process, it, to your point, goes a really long way with consumer awareness.
This reminds me of another one of my guests from today, this Toby from, Entia is the company. Entia has this blood monitoring approach for cancer patients who oftentimes end up having terrible issues with infection because their immune system gets so devastated.
Yep.
And oftentimes having to get into the hospital to treat that, it can by itself be a big risk to the patient. So that's another connected care opportunity. Now, quickly to bring it back to the core of what's driving a lot of the true progress that we're seeing in AI, it really does come down to diagnostics.
Yeah.
There is no care journey without some type of diagnosis. And what we found at HC1, which is, in full disclosure, the company where I'm CEO, and we are housing the Boombostic Health podcast as a component of the HC1 booth. If you start analyzing using AI, all of these signals across an entire lifetime that are coming out of lab information,
right,
you start seeing these pictures that before nobody ever saw. And the simple example I use is a Seurat painting, which is a pointillist kind of painting, where if you look at one little part of it, you just see a bunch of dots. But if you zoom out, you see this incredible picture. That's what's happening with AI applied to diagnostics, particularly as it relates to lab.
Yeah.
And I think what we're going to see is unlocking with these other connections, like what Tefka is enabling, where you've got more and more data that's actually available. So you don't have these huge blind spots in somebody's overall picture. This ability to empower patients to prevent disease, to get better faster, to get to where they ultimately are able to have these miracle precision medicines brought at the time of need. So I really feel extremely encouraged. Maybe just to wrap up the final thing, maybe one word for how you see what's going on in health. I'd say encouraged. How about you?
Yeah, I think that I'm encouraged as well and very optimistic that we are solving real problems that touch our lives. I'm sure you guys are doing all the testing and all the innovation and everything, so we're kind of like hyper users of this. But if we continue telling that message to other people, so I was recently interviewed and they asked me, who would you want to hear this message? And I was thinking to myself, head of CMS, yeah, head of FDA, yeah, all these guys, of course. But really, mothers, fathers, families, we're raising children. If we educate them early on health and understanding data and getting tested, doing whole genome for babies. And we're living in an amazing era that we can do whole genome for babies and have them have a better life. And we have all the wearables now that are helping us track and connect the wearables with the labs, interpreted with AI. We're living in an unbelievable time. And I really see, people taking ownership of this, and leaders in the industry are shaping and kind of like making the path for the masses of people to be more knowledgeable, take control of their health, get tested, have a much more informative and powerful conversation with their providers,
Right.
And so I'm very hopeful that we are improving health at an accelerated rate because of technology enablement and all that.
Right. So encouraged, optimistic, and then what's the word that jumps off the page for you?
I would say excited. It's very exciting to see all the things that are happening. To your point about all of the emphasis on wearables and using data and actual insights from data, I think this catalyst of change that we're seeing right now is going to help propel the value-based care world, because fee-for-service is broken. We all know it's broken, right? And unfortunately, there isn't a ton of reimbursement for the types of devices and technology that we're seeing here. But with enough demand and consumer buy-in and lobbying, right, hopefully now we can get some sort of acceleration towards either reimbursement or adoption of value-based care.
Yeah, yeah. And you see, we're talking about, leaders in our society that are pushing this agenda forward. You can give a good example of Mark Cuban speaking yesterday. So maybe you want to share.
Yeah, well, it's interesting when you look at what Cuban was talking about with Mark Cuban's cost plus drugs, which is about this sort of corroded, pre-existing, antiquated infrastructure that PBMs have in place, where they aren't adding value, they're adding costs. They're not actually doing anything beyond that. And that's obviously an area that needs to be reformed. And just bringing down cost, it's not just about having a cheaper pill, it's also about having the optimal pills so people actually are getting healthier, which our business Decision RX is in that space. So we're trying to solve for not only how do you diagnose people more proactively and prevent disease, but also when they do get diagnosed, get them on the right meds, which saves a lot of money. And then how do you use the optimal medical devices, which we have a business in that space. But I think what Cuban said, and also Rob Lowe was on yesterday talking about cancer and doing better to help people be healthier. We also had on the podcast today Ryght.ai and their CEO Simon Arkell talking about using a digital twin model and AI in order to match better those patients in clinical trial sites with the clinical trials. And that actually ultimately could take the time that's required for a trial, could take out 2/3 of that time, which is absolutely so exciting. So, well, I think we should probably wrap it up. Love the energy here. Thank you so much, Elliot and Emily, for joining me for this daily wrap up at the Health Conference 2025. This is another episode of Boombostic Health in the Wild. We look forward to seeing you all tomorrow again for another wrap up.